Assalamualaikum and good morning to one and all. Today we'll study about emetic drugs. At the end of this e-learning session, you are able to explain causes and mechanism of emesis and discuss pharmacology of emetic drugs. Let's see what is vomiting. So vomiting, it is basically expulsion of the content of GI tract. So when the GI tract content it is expelled from the body, it is called as the vomiting. So it is the process of expulsion of content from GI tract. Whereas the nausea, it is feeling of something like vomiting. Means still content it is not expelled, but you feel that soon you may get vomiting. So this nausea or vomiting, it may be the symptom of serious organic disturbance, especially involving any of the viscera of the chest or the abdomen. So the part of the body which is involved in the process of nausea and vomiting, it is the viscera. Viscera means inside part of our body. One, it is the peripheral portion, that is outside portion, right? Like skin, it is your outside portion. Now viscera, it is inside portion of the body. So inside portion of the chest, what is present? The lungs is present. So if there is excessive coughing inside the lungs or there is irritation, it may lead to the nausea and vomiting. And also if there is some problem or disturbance it is there in the abdomen, and abdomen, the important system involved, it is gastrointestinal tract. So there is disturbance. So if there is disturbance in viscera of the chest or the abdomen, then it may lead to nausea or the vomiting. Let's see what is mechanism of the emesis. So the emesis, it is a complex reflex. So first try to understand what do you mean by emesis. So emesis, it is the scientific term which is used to describe the act of vomiting. So if patients suffer from the vomiting, so that act, it is scientifically, it is called as emesis. It is not a result of only one factor. It is a result of multiple of factors. And there is not just one systems or an organ it is involved in the process of vomiting, but multiple organs are involved. Like we have seen that the organ present in the chest and organ present in a abdominal cavity, if there is some disturbance in that, it may lead to the vomiting. Likewise, this is the organ from where the stimulus it is started, but main process of the vomiting, it is controlled by your brain. So there is central nervous system, it is directly involved in the process of the emesis. So since multiple factors are involved in the process of the emesis or the vomiting, it is a complex reflex where this activity, it is coordinated by the vomiting center which is specially present in the medulla. So if you see if this is the brain, medulla, it is basically the lower portion of the brain. So this portion where your vomiting center is present. So if the activation of the vomiting center is there, irrespective of what type of stimulus it is. So stimulus may be different. Like someone, the stimulus may be the smell. If you have the bad and fishy smell, that smell also produces the stimulation of vomiting central. Likewise, some they suffer from vomiting when there is indigestion. So no matter what is the cause of the vomiting, but important thing is that the vomiting, it is coordinated by the vomiting center. And where vomiting center is present? Vomiting center, it is present in the medulla. So the lower portion of the brain, it is called as a medulla. So somewhere here the vomiting center is present, and activation of vomiting center, it gives stimulus to your GI tract. Okay, so activation of vomiting center will give stimulus to the GIT, and this stimulus which is coming from the vomiting center, it may initiate the process of the vomiting. Okay, so the center involved, that you must remember, it is vomiting center. Where it is present? It is present in the lower part of the brain, that is the medulla. So this is the first part of the mechanism. In addition to this, there is very important role of chemoreceptor triggering zone. So especially in case of blood-borne emetic substances, so any emetic substances, if they come in contact with the blood, so those emetic substances are called as blood-borne emetic substances. So these blood-borne emetic substances, what they does, they act on chemoreceptor triggering zone. So it is special zone which is present in your brain. So suppose somewhere here your vomiting center is present, that I have already mentioned in our earlier figure, then somewhere here there is presence of your chemoreceptor triggering zone. So this is your CTZ or the chemoreceptor triggering zone. So when it activate or their stimulation it is trigger when the blood-borne emetic substances are present in your blood. So through the blood, obviously they will go to the brain, and in the brain what they are doing, they produces or they give trigger to these chemoreceptor zones. Once there is trigger to chemoreceptor zone, there is activation of this CTZ. Activation of CTZ will provide stimulus or impulses to your vomiting center. So now this is your vomiting center, okay? So it will activate your vomiting center, and due to activation or stimulation of vomiting center, the patient will suffer from the vomiting, which is the act which is happened due to disturbance, especially in your GI tract. So there is expulsion of the content, it is occur from the GIT. Okay, so I hope you understood this mechanism by which chemoreceptor triggering zone it produces the vomiting. So the center point of mechanism it remains the same, that is vomiting center. So stimulation of vomiting center, it's very important in case of inducing the vomiting. So let's see what are the blood-borne emetic substances which can produce or which can induce the vomiting. So it including emetic drugs. We'll be studying today in detail about the emetic drugs which are intentionally given to induce the vomiting, and we'll see why they are given intentionally to induce the vomiting in later part of this session. In addition to this, the radiation therapy. So radiation therapy is given in case of patients suffering from the cancer. So radiation therapy produces disturbance, especially in case of your GIT, and this disturbance it may lead to vomiting. In addition to this, electrolyte disturbance which is happen in case of diarrhea, or sometime it may also happen to some medicines. So this electrolyte disturbance it may also induce the vomiting. Endocrine disturbance, especially in case of the diabetes, that is the chronic in nature. If there is release of certain hormones due to disturbance in endocrine system, it may also produces the vomiting. In case of the pregnant woman, we see that in case of pregnant woman in first trimester, means first 3 months of the pregnancy, the pregnant woman generally suffer from the vomiting. Why it happen? Because there is a change in hormone and hormonal imbalance. It is occur in case of the pregnant woman, because the hormones change very quickly from day one of the pregnancy to the third trimester, then sixth trimester, second trimester, and third trimester. So there is hormonal change. It's keep on occurring, and this hormonal change it may produces the disturbance in patient, which may give stimulus to the vomiting. Then cancer chemotherapy, the drug which is given for the treatment of the cancer. And lastly, the chemical emetic substances, all those if they are coming in contact with the blood, these substances are capable of inducing vomiting. Since when they are coming in contact with the blood, they induces the vomiting. Those substances or the stimulus, they are called as blood-borne emetic substances. Let's see what is the role of other center of the brain. So we have till now studied two important center, that is the vomiting center and chemoreceptor triggering zone. But remember that the vomiting it is not only occur due to these two centers. In addition to this, other centers are also involved in the process of vomiting. So those centers involved including the vasomotor center. So vasomotor center especially it modulate the contraction and dilatation of your blood vessel. So if there is disturbance occur in vasomotor center, then it may also give stimulus to the vomiting center to induce the vomiting. So next center it is the cough center. You may have seen that the person who having more cough, or if he is continuously coughing, then in those cases also he suffer from the vomiting. And lastly it is the respiratory center. Very good example is that if you inhale some smelly air, and you may have experienced this when you go into the fish market or somewhere where there is not good smell. So there are some person when they go to the fish market, they are suffering from the vomiting. Why it happen? Because you breathe very smelly air which is not pleasant to you. So sometimes some air it is pleasant to one person, it is not necessary that it may induce vomiting to another person also. So only some person when they are going to particular place, due to smell of that particular place, they suffer from the vomiting. So that is Very good example of involvement of your respiratory center in the process of the vomiting. So to summarize, the vomiting, it is a very complex phenomenon. It is not occurred due to involvement of only one part of the brain. Main part of the brain involved, it is your vomiting center. In addition to that, there is involvement of the chemoreceptor triggering zone, which is activated when blood-borne emetic substances come in contact with your blood. So when these substances are absorbed into the blood, then only patient will suffer from the vomiting due to activation of chemoreceptor triggering zone. In addition to that, we have seen there is involvement of vasomotor center, there is involvement of the cough center and the respiratory center in the process of the vomiting. So this is about the role of different centers of the brain and the mechanism by which vomiting it is induced. Before going to the actual emetic drugs, try to understand what is emetic drug and why you are giving emetic drug to the patient. So these drugs are recommended for the induction of the vomiting. So if any drug, if it is recommended for induction of the vomiting, or any drug if it is capable of inducing the vomiting, then those drugs are called as emetic drugs. Okay, and these are generally given intentionally to induce the vomiting. Now what could be the reason for inducing the vomiting? One important reason, when the patient accidentally consumed the poison. Now he has consumed the poison and you know that it is the poison, and after some time that patient starts showing a symptom of the poison and it may lead to death also. So instead of waiting for more time before going to the hospital, what you can do is you can give emetic substance to that particular patient. So when you give the emetic substance, it will expel all the content that is recently consumed by that particular person, and it will avoid their absorption into systemic circulation, because symptom will start only when the poison it is absorbed from your GIT and it's go into your systemic circulation. Okay, so these are the drugs which are recommended for induction of the vomiting. There are especially the two kinds of drug we are using. One, it is the apomorphine hydrochloride, and second one, it is the Ipecac syrup. So we'll start with the first drug, that is the apomorphine hydrochloride. So in these two emetic drug, what thing that you must remember is, first thing, how it produces the emesis, what are its side effects, and what dose should be given. Because remember that the high dose or overdose, it is not advisable in case of emetic drug. So you should give appropriate dose, and what can be done so that the vomiting can be increased. So this action can be increased with the optimum dose. Means you are giving less dose of the drug, but by taking other measures you can able to increase the vomiting action. Let's start with the first drug and we'll see this drug with reference to the different parameter that I have mentioned. So first thing, how it induces the vomiting. So it acts directly on the chemoreceptor triggering zone, and we know that when any drug which activate chemoreceptor triggering zone, it will also activate your vomiting center. Okay, so it will activate your vomiting center, and what vomiting center will do, it will activate your GIT for the expulsion of content from the GIT, and it may lead to the vomiting, so which is responsible for the vomiting action, or which is responsible for the emetic action. When it induces the vomiting, that is very important, because once you consume the poison, then vomiting action should be very instant. Suppose if you are taking emetic drug after consuming the poison, and if vomiting it is induced after 1 hour, then it is of no use, because till the time your emetic drug induces the vomiting, your poison it is already absorbed into systemic circulation, isn't it? So very important parameter in case of emetic drug is that it must have very immediate action. It should immediately produce the vomiting. So apomorphine, it induces vomiting within 10 minutes of intramuscular or subcutaneous injection. So you are giving apomorphine through the intramuscular or subcutaneous injection, and within 10 minutes of IM or SC injection, apomorphine is capable of inducing the vomiting. Now let's see if vomiting it is induced, from which part of your GIT, content of GIT it is removed. So that is also very important, because what happens when whatever thing that you consume, first it goes into your stomach. So it is present in your upper part of your GIT, so which consists of your esophagus and your stomach. But if some time it is lapsed, then from there it will go into the small intestine. So it will going into the small intestine, right? So in case if some content if goes into small intestine, because sometime it is lapse, then your vomiting drug or emetic drug, it must be of ability to remove the GIT content not only from the stomach but also from some part of your gastric tube, that is your small intestine. Otherwise what happens, from once it goes to small intestine, it will absorb into systemic circulation. So apomorphine, it expel content from upper intestinal tract, which consists of your esophagus and your stomach, and also it remove content from your GIT, that is small intestine. Okay, so this is how it expel the content. The action, it is more efficient if 200 to 300 ml of water it is given by mouth before the injection. So very good tactics is that you immediately after consumption of the poison, you can give 200 to 300 ml of the water to drink. So once the patient drink this water, it increases the volume, and this way you have also diluted the poison. So when there is increase in volume in your GIT, and after that if you give apomorphine IM or subcutaneous injection, then this water will help you to wash out the poison. So it will wash out the poisons and remove that poison along with your vomitus. So vomitus, it is the content of the vomiting which is come out from the GIT. So along with the vomitus, there will be the removal of the poison. Let's see what are the side effects. So although it is very useful, but apomorphine, it having very important side effect, it is CNS depression. It depends on the dose. So at therapeutic dose, it may not produce CNS depression. So at therapeutic dose, it may produce initially excitation of the CNS, but when you give the overdose, so initially there is excitation of the CNS and followed by there is depression. So let's see what are the symptoms of the side effects or overdose of the apomorphine. So overdose of apomorphine, it causes first excitation, and a symptom of these excitations including euphoria, that is feeling of the great happiness, right? Then it produces excitement of the brain, and we know that whenever there is excessive excitement of the brain, it may lead to the convulsion or it may lead to the epileptic attack. And obviously when it goes into the CNS, it is going to activate your vomiting center. And what will be the result of vomiting center activation? It produces the violent vomiting. So although you need the vomiting or you want to induce the vomiting, but violent vomiting, it is not advisable. So always remember that violent vomiting, it is not good. Sometimes it is painful. So in your GIT also there is the spasm of the muscle which may lead to pain in your GIT, and patient will suffer from some complications. So violent vomiting, it is not advisable, and that is what happened in case of the overdose. So first few symptoms like euphoria, excitement and convulsion and also violent vomiting are due to increase in CNS stimulation. So it is due to the excitation of the CNS. But when the patient reach to this stage, after excitation of the CNS, it is followed by acute circulatory failure. So there will be the possibility of circulatory failure, and it may lead to the fall down of the blood pressure. And lastly, patients suffer from respiratory depression, where the patient unable to breathe because there is depression of the respiratory center. That is due to the CNS depressant effect of your apomorphine. Okay, so at high dose or at overdose, initially there is excitement of the CNS, and followed by that there is depression of the CNS, and this is very dangerous because depression of CNS may lead to death of the patient, because if there is circulatory failure and respiratory failure, obviously there is no chance of survival of the patient. So always remember that although apomorphine, it is life-saving drug, it induces the vomiting and it don't allow absorption of the poison, but at overdose it may also produce life-threatening side effect on the patient. Okay, so if this happens, suppose if this happen, if some patient inadvertently, or he was not known about the dose to be taken, and if inadvertently more dose it is given, or sometimes you are given normal dose, but some patients are more sensitive to the CNS effect of the apomorphine, then in such cases even normal dose produces CNS depression. So if this is happen, then what can be done? So this depressive action, it can be reversed by administration of narcotic antagonists. So if you know that the patient has taken high dose of apomorphine, or the patient it's reacting more to the apomorphine and it produces the CNS depression. So in such cases you can reverse this depression by administration of narcotic antagonist, example naloxone. So you can give 0.8 milligram intramuscular injection of the naloxone, which help you to reverse the CNS depression which is produced by the apomorphine. So as a pharmacist, you must know what are the symptoms and what can be done if those symptoms are seen if in case of overdose of the apomorphine. So we are done with our first drug, how it can be given. So before going to the second drug, first we'll see what should be the usual doses of the apomorphine. So in case of the adult, you are giving 6 milligram of the apomorphine, whereas in case of the children, the dose should be extremely reduced. So you can see the dose in case of the children, it is 100 times less as compared to adult. So 6 divided by 100, it is 0.06 milligram per kg. That is given to the children by through the IM, that is intramuscular or subcutaneous injection. So very important thing in case of dosing of apomorphine, that pharmacists must remember, it is given through intramuscular route and subcutaneous route. It is not given through the oral route. So that is very important part of the apomorphine. So dose, it is 6 milligram in case of adult, 0.06 milligram per kg in case of children. But if you can give 200 to 300 ml of water before giving the injection of the apomorphine, it can quickly induces the vomiting. This is the usual dose. Let's see what dosage form we can use. We can use the injection, that is intramuscular or subcutaneous injection. So obviously the drug should be present in a solution form. So drug present in a solution form, and that through the vial you can take the injection and that can be given to the patient. The injection which is intended for the IM or subcutaneous route. And secondly, apomorphine, it is also available in soluble tablet form. So what you can do, apomorphine can be dissolved in water for injection, which is sterile in nature, and once it is dissolved, the fresh injection of apomorphine can be administered to the patient. So in the two form it is available. One, it is the solution form, and another it is the soluble top tablet that can be dissolved in water for injection, and the fresh solution of that can be injected through intramuscular or subcutaneous route. So this is all about pharmacology of the apomorphine. Let's see what are the contraindications. So emetic drug and also apomorphine, it is contraindicated in case of unconscious patient. Why it is contraindicated in case of unconscious patient? Because unconscious patient is not in the condition to expel his GIT content, right? If you are conscious, then only you can expel. So sometimes if patient is unconscious, that may be due to result of the poison that he has consumed. Then in such case, for such patient, you should not give emetic drug, because if there is expulsion of content and that vomiting it is accumulated in your mouth, then it could possible that vomiting may enter into your respiratory tract. That is very dangerous. And if there is vomitus, it is enter into respiratory tract, then it may produce severe breathing problem to patient. It may lead to the choking, and the patient may die due to the choking effect of that vomitus, which enter into the respiratory system or the lungs. So very important thing is that emetic drugs, not only apomorphine, all emetic drugs should not be given to unconscious patients. So this is the first contraindication. Second contraindication is that patient with advanced age, you should not give emetic drugs, because their system, it is very weak. If there is violent vomiting action, then it may produce some complication in your GIT system. If patient it is aged one or he is the elderly, so it should not be given to the patient with advanced age. It also should not be given to patient who have ingested caustic substances. Now what happens when you give to the patient who ingests caustic substances like extreme alkali, or if someone has ingested with the acid, then if it is going into the stomach, so while going inside the stomach, it also produces some corrosive action on your system, right? So now if you bring out again through the vomiting action, then it may produce additional corrosive action on your stomach. So in such cases, instead of giving emetic drug, you can call that patient for gastric lavage. So gastric lavage, it is more appropriate in place of giving emetic drug. Okay, so instead of emetic drug, you can ask that patient to go for the gastric lavage. So that could be the good option in case of caustic substances. In addition to this, it is also contraindicated in patient with morphine sensitivity. So there are patients who are sensitive to the effect of the morphine. It means when they take the morphine, they produces more CNS depression, or they produces morphine poisoning due to the CNS depression effect. So what this indicate, if those drugs are sensitive to the morphine, it means these drugs are also sensitive to the action of apomorphine, because apomorphine, it produces depression of your central nervous system, and this depression, it is life threatening to the patient. So you must have, or you must take quick history of the patient from the relative before injecting the apomorphine. So these are all contraindication of the apomorphine. So we have seen many side effects and contraindication which are related to the apomorphine. Let's go to the new drug, that is the Ipecac syrup. So as we have seen, apomorphine has many side effects. So Ipecac syrup, it is generally preferred. Why it is preferred? Because it causes less CNS depression, and CNS depression, it is life threatening. So since Ipecac syrup doesn't produce a CNS depression, Ipecac syrup, it is preferred over apomorphine. And one more reason is that Ipecac can be given through oral route. So there is no need to have the special person to give the injection of apomorphine, that is to give subcutaneous or intramuscular injection of the apomorphine, right? So Ipecac syrup can be ingested at the home, because it is to be given through the oral route. So this is the reason why Ipecac syrup, it is preferred over apomorphine. So let's see what is the source. It is obtained from the dry root of Syphilis ipecacuana. So this is the herbal source. So Syphilis ipecacuana, it is the plant, and it is obtained from their dry root. So it is basically the extract of Syphilis ipecacuana. Let's see what is the action, how it works. So it's worked through two important action. So one action, it is before absorption into systemic circulation. So the action, it is that produced before absorption, it is irritation. What it does, it produces the irritation of the GIT, and we know that the irritation of the GIT, it produces two reflex action. One, it produces the diarrhea, and secondly, it also produces the vomiting. So if it going into small intestine, it may produces the diarrhea, but if it is present in your stomach, irritation of the stomach, it may lead to the vomiting. So before absorption, it produces the irritation in the stomach, which is responsible for the vomiting action. In addition to this, after absorption, what it does, after absorption, where it goes into your blood, isn't it? And any emetic substance, when come in contact with the blood, what it stimulate? It will stimulate your chemoreceptor triggering zone. This CTZ gives stimulus to the vomiting center, which may induces the vomiting. So this is how, through dual action, before absorption through irritation, and after absorption through stimulation of the CTZ, Ipecac syrup produces very good emetic action. Now if you want to further increase emetic action, then what you need to do is, you need to give 200 to 300 ml of water along with Ipecac syrup, and this we have already also seen in case of apomorphine. So in both the cases, administration of 200 to 300 ml of water, it is better to increase the emetic action of both apomorphine as well as Ipecac syrup. Okay. How they induce the vomiting? So it induces vomiting of reflux material, and especially from upper intestine and from the gastric content. So what are the upper intestine? Upper intestine is your small intestine. So small intestine, it is called as upper intestine, whereas large intestine, it is called as the lower intestine. And it also remove content from your whatever content it is present in the stomach. So that content which is present in the stomach, that is called as gastric content, and the content from the upper intestine can be easily removed by giving Ipecac syrup. So this is all about the Ipecac syrup. Let's quickly see the dosage. So dose, it is the 20 ml. You can give orally with 200 to 300 ml of the water. You can administer to the patient, whereas in case of children, the dose, it is the half of the adult dose. So if you remember, in case of the apomorphine, the dose, it is extremely less in case of the children. We have used 100 times less dose. But in case of Ipecac syrup, in case of adult, it is 20 ml, whereas in case of the children, just half of the 20, that is 10 ml, can be administered with 200 to 300 ml of the water. So this is about the dose. Another important thing that you must remember in case of the Ipecac syrup is, if vomiting does not occur within 30 minutes, a gastric leakage should be performed. Why? If there is no vomiting within 30 minutes, then what will happen? The drug will go into systemic circulation. And remember that it is not advisable that although after going into the blood, it produces activation of the chemoreceptor triggering zone and it further produces the vomiting, but ideally you should not allow absorption of the Ipecac. Why? What is the reason? Because absorption of the Ipecac may causes myocardial conduction disturbance. The Ipecac syrup, it having the effect on cardiovascular system. What it does, it produces or it disturbs the myocardial conduction, that is firing of SA node, conduction of the impulses from SA node to AV nodes, and then further there is conduction of the impulses to produce the action of the cardiovascular system. It is disturbed if Ipecac syrup it is absorbed into systemic circulation. So to avoid that, if there is no vomiting within 30 minutes, then you should conduct gastric lavage for that patient. There is no option. It will remove the poison, also it will remove your Ipecac syrup, and there won't be the action on myocardium, and there won't be the myocardial conduction disturbance. Okay, so today we have studied about two important drugs. First one, it is apomorphine and Ipecac. So to summarize, the preferred drug it is the Ipecac because it having less CNS inhibition, or it produces the less depression of the central nervous system. Also it can be easily administered through the oral route, whereas in case of apomorphine you need to administer apomorphine through intramuscular and subcutaneous route. Okay, so based on all these things, Ipecac it is preferred as compared to the apomorphine. So I will be shortly releasing the quiz attendance feedback form link in your chat box. So thanks for watching the session. If you like my session, then do remember to give me a thumbs up, and for more such learning, subscribe to the channel